Okay, this is video 2. We're talking about health literacy, what it is not, and now we're going to talk about health outcomes. Patients with limited health literacy skills have higher utilization of treatment services, more frequent emergency room visits, more hospital admissions. This all leads to higher health care costs. And this affects all of us. It may impact our raises, whether or not we get raises at all. It affects whether or not we get the supplies that we need or the equipment that we've requested within the department, because those costs are going toward the expenses that are incurred by patients with lower health literacy that come to the hospital unnecessarily. Patients with limited health literacy also have lower utilization of preventative services. They don't tend to get flu shots. They don't get their mammograms, their pap smears. They don't keep their children current on immunizations, except for when they start school. The schools are strict on that. They tend to be behind. They don't understand the risks involved in foregoing some of these options for themselves. Statistically, only 12% of the population is considered proficient in health literacy. That means almost 9 out of 10 patients that we see lack the skills they need to manage their health and prevent disease. 9 out of 10 patients, or at least the patients on the lower end of the health literacy score, define their health as poor and tend to lack health insurance when compared to patients with higher levels of health literacy. There's a few ways to test health literacy. There's several options. There's a few that I'm going to cover with you today. The first one is the single item literacy screen. And it says, how often do you need to have someone help you when you read instructions, pamphlets, or other written material from your doctor or pharmacy? Sure, there's still going to be people who say never. They want you to rush through discharge instructions. They're ready to go, and that's going to happen. But at the very least, it's an icebreaker. It opens the door. It lets your patient know that you're willing to listen, that you want them to ask questions when they need to. And again, the plain language part that we talked about needs to be good. You need to be open to the patient. They need to know that you're willing to listen to them and willing to answer their questions. There's no shame involved in not knowing. Sometimes we forget the language that we use is not common to the patients that we care for. The second test that I'm going to tell you about is the REALM, Rapid Estimate of Adult Literacy in Medicine. It's this list of 11 words. And no, it's obviously not reading comprehension, but research has shown that when you score poorly on those 11 words, it tends to correlate with poor literacy skills. At least it helps you identify patients who may be at risk. Being aware will help you know who you need to help and how much help they may need. The last test I'm going to talk about is the TOEFL. I'm using this one, the shortened version actually, in the test of functional health literacy in adults. I'm using this at my own facility in a research study that I am participating in. It's very exciting, by the way. We talked about being published, and it's not going to happen this semester, but I'm going to still work on it through the winter break and maybe into the new year. I don't know how long that part takes, but it's 36 questions, the shortened version is 36 questions, multiple choice, and it's modeled after actual hospital documents. Helps identify, again, patients who are at risk for poor health literacy. They are allowed 7 minutes to complete the test, and you know, no shame is involved. You need to just encourage them to finish it as best they can. And I've been explaining to patients that we're trying to learn how we may need to reword some of our documents to make it easier for patients to read and understand. I've had a good response so far, so I'm excited to see the final results there.